Hey everyone, Teresa here, having another episode about healthcare and AI. So today we're going to be talking about something that's been making waves in the AI world, and it is the massive shift in AI policy. I've been watching what's happening and seeing the executive order that came out yesterday. I've been thinking about it. Here's a little history, and then let's have a little discussion about it. So, back in 2023, the Biden administration dropped what a lot of people considered was a really groundbreaking executive order on AI. It just wasn't another piece of legislation or paperwork. It was a really comprehensive framework, and it touched everything from national security to civil rights. So it created the first ever AI Safety Institute. It established testing protocols for high risk AI systems. It put accountability measures into place, and it got federal agencies working together on AI governance. Yesterday, January 20th, 2025, the new administration changed. They revoked the order, and it completely is going to shake up the landscape of AI regulation in America right now. What does this mean for tech companies and for consumers? And consumers here, I'm talking about healthcare patients, members. And I was doing a little bit of analysis on this Brookings Institute paper that they wrote probably like a year ago. And I've also looked at the National Law Review because why not go to the lawyers? They when you've got something that's legislation or regulatory in nature, right? So here's the reality after reading a bunch of different articles, really just thinking through what this means. We're right now going to be facing what I would call a regulatory wilderness, and that just means that we're not going to have a whole lot of federal guidance. So that's going to look like a patchwork of state regulation, like having every state or every vendor having to look at different international standards. How are we going to interact in the international world up on the stage when we don't have piece of legislation that we're standing behind? And how are we going to maintain ethical AI practices without clear guidelines? And again, those ethical practices do travel across the world. I don't know if you guys know this or not, but a lot of tagging that's being done on our LLMs is actually being done overseas. People are actually sitting down, scouring the internet and data tagging this for classification, and that's how the AI models learn. So it's not just what's happening here in the US, it's something that we need to think about internationally as well in our relationships. One interesting thing that I have seen over the past couple of years is that the private sector is stepping up. Much like how we have Da Vinci that have been private and public partnerships, um, right now companies aren't waiting for government direction. Why? They need to have frameworks. They understand the importance of that and ethical guidelines. So the Coalition for Health AI, or CHAI as it's called, they're starting to emerge as a leader in responsible AI development. They've released an open source applied model card system. It's out on GitHub, and it's sort of like a nutrition label, but it's for AI models in healthcare. The Brookings Institute, it did point out that global leadership in AI governance, it's crucial, and we need to have governance not just out in the world for international means, but we need to have governance, a really good governance model in each one of our own organizations. Whether we have federal regulations or not, someone needs to set some standards. I'm thinking 6 months, 1 year, 2 years down the road. I really do agree with the National Law Review. Some guidelines or areas that companies should be focusing on, and those areas are building strong internal AI governance. Very important. Staying on top of your international and state regulations, depending on where you're doing business as a vendor. Collaborating with industry partners, making sure that we are having collaborative conversations across many different industries to understand how AI is being used. Finally, developing robust risk assessment strategies. It's a risk out there when we don't have federal oversight, or we don't have good guidelines, pathways, guardrails. You need to have really good risk assessment strategies to make sure that you're in compliance with your state laws, and if you're a neighbor, or if you're on a neighboring state laws as well. Bottom line, AI is not waiting for anybody. So whether we have federal regulations or not, the technology really is evolving at a breakneck speed. And the real question really isn't about just regulation. It's about how we ensure that we've got good AI development and that AI development remains innovative and responsible. What do you think about these changes coming up? What are your thoughts? I'd love to hear them. Put them down in the comments. All right, we'll be back here again next week where we're going to be talking about AI and healthcare. See ya.